My name's Ashley Scott, and I'm an Associate Professor of Teaching in the UBC School of Nursing. And I'm hosting this session on behalf of our Scholarship of Teaching and Research Committee. I'd like to begin by acknowledging that while we're gathering virtually today, I'm hosting this event from my office at UBC's Point Grey campus, which is situated on the traditional, ancestral, and unceded territory of the Musqueam people. UBC Vancouver sits on land that has been a place of learning for the Musqueam for thousands of years, and we recognise their enduring relationship to this land and are grateful to work and learn here. Today, we've got the privilege of hearing from two distinguished speakers whose work is shaping the future of community-based dementia care and graduate research training. Dr. Jennifer Baumbusch is a professor at the UBC School of Nursing and the outgoing CIHR Chair in Sex and Gender Science, whose recent work has focused on the dynamics of caregiving in an aging society. Dr. Baumbusch's research program is dedicated to enhancing person and family-centered care for older adults and people with lifelong disabilities. Her work addresses the interface between formal paid caregiving and informal unpaid care in various settings, from acute care to community-based services. In 2023, as part of her CIHR Chair's capacity building objective, Dr. Baumbusch established an innovative pan-Canadian interdisciplinary graduate writing group. Through virtual workshops and collective projects, this group has been working towards publishing peer-reviewed papers based on a longitudinal qualitative research study titled Navigating Care and Negotiating Health Services, the Experiences of Community-Dwelling People Living with Dementia and Their Family Caregivers. Dr. Baumbusch will share insights from this experience and the process of leading such an impactful initiative. Dr. Baumbusch is joined by Christine Meng, a doctoral student here at the UBC School of Nursing and an active member of the graduate writing group. Christine will present her group's work on trauma-informed practices in community-based dementia care, a paper developed through the writing group. Together, Dr. Baumbusch and Christine will discuss the challenges and opportunities of working with extensive data from a longitudinal study and how this experience has been invaluable for graduate training. After the presentation, we'll have some time for some questions and discussion, so please make a note of any questions that arise, and I'll encourage you to bring those thoughts and queries forward at the end. So with that, please welcome Dr. Jennifer Baumbusch and Christine Meng.
So much for that lovely introduction. I'm going to have you write all of my introductions from now on. That was amazing. Thank you. And thanks everybody who's joining us today. I know in the future people will watch the recording, but we really appreciate that you took time today from your busy schedules to join us. So as Ash said, I'm going to start with a presentation about the research program and also about the student writing group. And then Christine is going to present her group's paper that came from that. And then I have a few questions for Christine. So we're going to have a bit of a discussion and then we'll open it up to the whole group. I talk a lot, so I can't stop my presentation to answer questions, but at any point in the presentation, if you have questions, pop them in the chat so we can make sure we get to them at the end. And so I will get us started. So welcome to our presentation on building capacity in dementia care research through an innovative pan-Canadian interdisciplinary graduate student writing group. What a mouthful. And so this is my part of the presentation that I recently co-presented with one of our team members, Lucy Curvin, at the Canadian Association on Gerontology conference. So in 2020, I was amazed to receive a CIHR Sex and Gender Science Chair. And so this was a group of chairs that was awarded to people across Canada to expand our knowledge and understanding of sex and gender science. And I was fortunate to receive the chair that was co-sponsored by the Institute for Aging, and it focuses on caregiving in the community for people living with dementia. So the focus, a couple of the objectives of the chair were to use novel methods to explore sex and gender related mechanisms underpinning health and disease. My work focuses much more on gender science or gender-based analysis, because I'm looking at the social context of living with dementia and caregiving for a person living with dementia. Another key objective of the chair was to support capacity building. And for a long time, I struggled with this objective because we received the chairs, the group of us, and then a short time later, of course, the COVID pandemic struck. And so originally the capacity building component was going to be much more in person and have a whole bunch of different things. And then COVID happened, and I really was like, how do we do this? And what would this look like in this context? So I'm going to talk about that in the latter part of my presentation, but I just wanted to be clear that this is part of a core part of the chair, and that was really important to integrate into the work that our team was doing. And so while so as Ash said, the main study for this project, for this chair, was negotiating care and navigating health services, the experiences of community dwelling people living with dementia and their family caregivers. So the chair itself was funded for $700,000, and it didn't fund my salary, but it funded research and capacity building, which was amazing. And so this is the qualitative arm of the study. There is another arm of the study that uses data from the Canadian Longitudinal Study on Aging. I'm not talking about that today. That involves another whole project. But this was the qualitative piece. And so in this study, we were looking at the gendered experiences of people living with moderate to advanced dementia and their family caregivers as they negotiate care and navigate services in the community. And the reason that I shaped the study this way is because we know from other research that most people want to live at home and most people want to die at home. And a lot of our system is set up around supports for people who are more in the early stages of dementia. But I am really interested and curious about how do we support people to live in community even through that sometimes more challenging period of moderate to advanced dementia. And how do we support family caregivers if they choose to continue to live in community with them? And I was also increasingly fascinated by what happens to families over time. So much qualitative research and research in general is what we call more cross-sectional. So we're talking to people at one point in time. And the luxury of having this chair and being at my career stage is that I could really start to explore temporal aspects of caregiving, which I'm very curious about because we need to realize that no situation really is static and life is very dynamic. And if we're only talking to people at one point in time, we're losing a whole bunch of like, what does the progress of this experience look like? How do we get from there over to here? So we set this up very much as a study that was going to take place over time in order to understand better about some of the complexities of this journey. So this is a group that I call the core research team. This was everybody that sort of has worked on this study in terms of generating and analyzing the data. And so this is another piece of it. While I received the chair, you never work in isolation. And in qualitative research, I think it's very important to build a robust team because they really can help you see things that you might not think about, and also an interdisciplinary team. So I'm not going to go into everyone's bios, but rest assured this was a superstar team and people that I really enjoy working with. And I really just want to highlight Dr. Heather Cook and Kishore Sithrathaman, who is a doctoral candidate at Simon Fraser University's gerontology program, who were really the people on the ground collecting the data. Because one of the things when you're doing longitudinal data like this is you have to build rapport and relationships with your participants because you're coming to them many, many times over time to contribute data. And so that relationship that they form with the people and you're not always mixing it up, they're always hearing from the same person is so important. And I've had participants reach out to me to tell me how valuable they found that relationship. So I'm grateful because, you know, your qualitative study is only as good as the data that you collect. And we have really, really good data. So what did we do? The study period of active data collection took place from August 2020 to October 2023. So you can imagine in August 2020, we were sort of deep in the reeds of public health measures around COVID. And we followed these families all the way to October 2023. And we followed families for a 2-year period. So some people were recruited in August 2020, and they continued with us up till August 2022. And you can see some people came in later in October 2021, and they finished up with us in October 2023. And part of this is also related to purposive sampling. So we were working really hard, and we're not always successful, at generating a sample of participants that was inclusive of women, men, and gender diverse individuals. And so some of our recruitment strategies became more refined over time when we were really trying to reach people who had different family arrangements, different backgrounds, to make sure that we had some diversity in the sample. We also wanted to recruit people from all around the province of British Columbia. So that meant people from more rural and remote areas, including, and also people from urban areas. So the data collection that we did, participants were asked to take part in quarterly interviews and then also monthly diaries over the 2-year period. Originally, as I'm sure you can guess, this study was created pre-COVID, and we were actually going to do were participant observations in people's homes and accompany them on medical appointments and other activities in community. Obviously, when we started the study, that wasn't possible. And so we became quite reliant on these monthly diaries, which turned into a really interesting methodological journey as well. Some of the families did stay with us for the whole 2-year period. Some families' participation concluded if the person they were caring for moved into a long-term care home or passed away. And in those situations, we asked them if they would do an interview with us about 3 months after that event, just so we could learn what that transition was like for them. We had one family where it was quite a young adult daughter caring for her aging parents, and they didn't live in the same city, and it was kind of at a distance relationship, and they didn't end up completing data collection. And then that was just because if you've been a caregiver, know a caregiver, it's an overwhelming situation, and there wasn't enough space in their life to continue on with the study. So at the end of the day, we conducted 72 interviews and have 160 diary entries in our database. And I'll just comment, the diaries are comprised of a very structured part, which asks people about appointments, out-of-pocket spending, those kinds of things. And then a very unstructured piece, which is just, reflecting on the past month, how did things go? So the participant group was made up of 15 families. There were a range of caregiving relationships. We had 7 children, 6 spouses, 1 sibling, and 1 daughter-in-law. But all of them were primary caregivers for a person living with dementia. And the majority of them co-resided in the same home. That was our goal at the beginning of the study. But again, because we were curious and interested about different types of caregiving relationships, there were a couple of situations where the people didn't live necessarily in the same residence. The age range of the caregivers was 36 to 83 years. So you can see this is a huge range of people that are caring for people living with dementia. And I think this is so important to recognize the needs and supports of a 36-year-old caregiver may be quite different from someone who's 83. And at the end, we had 12 women and 3 men participants. For the analysis, and I really wanted to give you a snapshot of what this looks like, this is a huge amount of data. So when we talk about big data in administrative data and quantitative data, I think we all have a sense of what that is. But we also have big data in qualitative research. And the amount of coding and analysis work that went into this was tremendous. And a lot of people critique sometimes of qualitative research. You can look at papers where people write about, you shouldn't be doing salami slicing, which is where there's a lot of overlap between papers that people write off of a single qualitative study. And I like to challenge that view a bit. I think about it like carving a turkey. And someday I'm going to write that paper. So I'm copywriting that title right now. That in the reality is you can and ought to publish several papers off of a qualitative study if you have that range and depth of data. So again, going back to contrasting with that cross-sectional study. So if you do a cross-sectional study with 15 people and you've interviewed them once, yes, I can see that maybe you get 1 or 2 papers out of that. 3 might be squeezing it a bit much. depending on the length of your interviews and the diversity of data you collected. But when you have worked with people over 2 years, you have a lot of things to think about and discuss in publications. And in longitudinal data, you also have case studies. So you have 15 families that you've kind of walked along a journey with them, but you may also choose to do a single case study paper where you have 2 years worth of data, which is still a lot of data with a participant, or you might compare and contrast some cases. And so pick a certain number, like 3 or 4 or 5 cases, and do the work that way. So you're also in a way drawing upon case study methodology in terms of the options that you have. So when we ended up with our code book, which went through the usual steps of the core group getting together, developing the code book, we ended up with 24 main codes and 63 subcodes. So I wanted to give you an example of one of those, which was family experiences over time, the journey together. So that was our main code. That was one of those 24. And then under that, we had 5 subcodes: changes in the caregiver, in the family, changes in the person living with dementia, changes noted between interviews, future planning with changing health, or changes in the caregiver, and loss of friends, social network over time. So if you look at our code book, we have 24 of those and then a bunch of subcodes under each one. So it was at this point that we were partway through collecting data that we published our first paper, and this was the core group paper, which was looking at exploring the impacts of COVID-19 public health measures on community dwelling people living with dementia and their family caregivers, a longitudinal qualitative study. So this paper was published in 2022, so it was before we finished data collection with everyone. And so we took a subset of the families who we had followed since August 2020. Again, their data collection was almost finished because that was 2 years later, and we published the study. And then we were sitting with not just a mountain of data, but a mountain range of data. And I was still struggling with this idea of what does capacity building look like as one of the main objectives of the study. So our core group talked about this quite a bit. We meet regularly. And one of the ideas that we came up with was to have a graduate student writing group, but not just any graduate student writing group. So one of the amazing things about what we learned during COVID was we don't all have to be in the same place to form community. And so instead of, sitting at UBC and saying, okay, well, we'll get some UBC students, some SFU students, we'll do this, we were able to envision a student writing group that was pan-Canadian. And so that is what we decided to do. And we already had the initial analysis completed of most of the data because this started a bit after that first paper was published. And we were able to think, okay, here are some papers that we think are really important and could come out of a writing group. As a core group, we don't have the capacity to write all these papers, but why don't we work with students and learn something from each other, and created this graduate student writing group. So our group was comprised of these 7 wonderful people, and a real focus in the recruitment that I'll talk about in a moment was that the group was interdisciplinary. So we had people from nursing, from social work, from gerontology, population health, public health, and community capacity building, which was amazing because we brought so many different perspectives into the team. And it was pan-Canadian. So people from UBC like Christine, from SFU like Shimona, and also Kathy Bertoni, of course, from UBC. And then McMaster, University of Alberta, University of Waterloo, University of Ottawa. Amazing. And so initially we had thought funding for 5 of the students, but Christine and Shimona were already working with me on other projects, and I was really happy that they could also join. So we ended up with our group of 7 students. So then our team developed a recruitment plan. So what did that look like? We had a call for applications of interest. Even writing the advertisement for this took a lot of back and forth and refinement. But we really focused on graduate programs, social media, and a group from the Canadian Association on Gerontology called Student Connection. And we worked our networks to be able to spread the word about this writing group. The requirements that we asked for people was that they were currently enrolled in a graduate level program at a Canadian institution. and that they had an interest in dementia care and aging research. And this is pretty broad. Some people had a real focus in this area, and some people were kind of on the periphery, but were like, hey, I'm really interested. And that was okay. We did want people who had graduate level qualitative analysis training because this wasn't a course in how to do qualitative research. This course was really around engaging with data, and so people needed to come in with some knowledge around qualitative analysis. And then the ability to attend monthly Zoom sessions. And this is important when you're building a group, that people come together. And again, it was on Zoom, so the expectation was that people could commit to that. The training expectations, so what we were offering people were peer collaboration, interdisciplinary networking, conceptual and theoretical support and mentorship, and I would say also writing support and developing a manuscript. And we had these monthly educational sessions, which I'll share about in a moment, and then a $5,000 stipend. So this was an important component, and with funding from the chair, people were provided with funding to spend their time with us. We also recently had a group attend the Canadian Association on Gerontology conference, which I'll show at the end, and we also covered expenses for people to attend. So as I said, in the end, we had 7 participating trainees with a vast range of experience and interests. And then our core group came together to collaboratively evaluate the applications. And what the applications were was a statement of interest, their experience with qualitative analysis, and publishing record. Sorry, I just realized I followed my train wrong. So I should have said we got 16 applications from across Canada. We had collaborative evaluation. And what I'll add to this is that we weren't looking for people who had the most publications. We weren't looking for people who had the most of anything. We were looking for diversity and bringing together people with a range of experiences in order to learn together. So, and also from a range of institutions and a range of disciplines. So now I can get to the end of my train to say that we ended up with the 7 participating trainees who I introduced in the previous slide. So what was our training approach? So we came together with this flexible hybrid engagement idea. There were monthly sessions that lasted 1.5 to 2 hours. I often talked too much, so they went over time, which wasn't great. We did that over 7 months. And I believe it was started in June 2023 and went to December 2023. And here we are a year later. And then we also used a collaborative communication platform. So as the full group, once we came together with the students, we talked about what would work. And we picked Slack, which worked well for some people, not so much for me, but I think was a great additional way, in addition to emailing, for people to connect and communicate. So what we did was we really encouraged student leadership, and people came together in smaller groups and formed teams based on shared interests. So we provided sort of that list of, here's what we think are some papers potentially. It's a very organic process. I am the type of person, I don't put a lot of boundaries on things. So we had a list, and people could decide what they wanted to do and come together. And then we encouraged those teams to meet independently and draw on the core team as needed. And then we really tailored the mentorship with the groups. So at our team monthly virtual sessions, once we kind of got into the data, we would talk about their paper ideas and start to develop those. And then they had the opportunity to access team members like Dr. Khan, and Kishore, who really knew the data if they wanted to have questions answered about particular aspects of things. So in terms of what the topics were for our monthly sessions, when you look at the circle around the screen, this is what we talked about and what are the focus. I think we started with conceptualizing, or we started with thematic qualitative analysis. Then we talked about conceptualizing qualitative studies. We talked about journal selection, peer review and submission process, navigating authorship, which is always an important thing to do in big groups, integrating qualitative data into manuscripts, and novel approaches to knowledge translation. So one of the things, we should always do when we have an initiative is we embedded some evaluation into it. And so Lucy, who was really the administrative superstar of this group, and Lucy is a core team member and a PhD candidate at SFU Gerontology, really did this part to make sure that we were continually collecting information from the student participants and understanding what they needed and what was working well and what wasn't working well. So we did this primarily through anonymous online surveys. We did a kickoff check-in in June 2023, then a midpoint in August, and a final check-in in November. And so these really carried through with those virtual sessions. The strengths the students shared were that they enjoyed those monthly sessions, the check-ins and meetings with the core team, the educational resources we provided, and the communication platform. Areas for improvement, more hands-on writing support. And I think that that has come now, and written feedback came more now as we're really writing the manuscripts. Setting timelines and expectations. This is not a strength of mine, so I'll take that on board. And supporting navigating divergent interests. So I think, making sure everybody's needs were met within that group. So this is a timeline and where we're at now. As I said, in May 2023, we did the recruitment. Then we had training sessions from June to December. And then students really got into the data, and we provided data through UBC Secure shared network platform. I don't know really how to talk about that because I'm not a computery person. But then students had access to data relevant to their particular paper. So they didn't have access to the full database, which is huge. But once the papers are really well defined, we created databases for them and data files that they could access. And then since November 2023, we've been really working on manuscript preparation, submission, and revision, which is not always a quick process, right? So where we're at right now, we have 2 manuscripts that are submitted and under review, and 2 that are still in preparation but getting close to submission. And the paper topics, we have one on masculine caregiving, which is an amazing single case study paper. Christine's going to share her group's paper about trauma-informed care. There's another paper on future planning, and then another paper on the landscape of decision-making, which also brings in a lot of policy analysis. And I'll conclude this part just with this lovely picture. So the group recently got together in Edmonton and got to meet together in person for the first time. I wasn't there, but Lucy and I joined online, as you can see on the screen behind them, and they all did superstar jobs of presenting their different papers and talking about what this experience was like. So as I said, I'm going to stop there. That's a lot. But I'll now hand it over to Christine, and she's going to share the trauma-informed care paper that her group did as part of this project.
Thanks, Jennifer. Hi, everyone. Thanks for being here with us. And I'm very happy to share one of the paper developed through Jennifer's writing group on using a trauma-informed care approach to understand caregivers experiencing accessing formal support in dementia care. Before I get into the paper, I know Jennifer already shared introduction for the core team members, but I like to spotlight 2 team members in my small group who contribute a lot to this paper. So Safira, she is a Master of Arts in Community Engagement student at the University of Alberta, and her research is in citizen engagement in home care alternative. And also Busola, she is a PhD candidate at the University of Waterloo, and her research is focusing on policy development and implementation for community alert system for locating individuals living with dementia. So to start sharing the research background and research question for our paper, caregiver play an essential role in supporting and caring for individuals living with dementia. However, their needs and contribution are often overlooked and unrecognized within the formal support system. And over time, this marginalization can contribute to long-term trauma. And in terms of caregivers accessing formal support services, they often encounter a healthcare system that is ill-equipped to address their complex social, emotional, and physical needs. So our research question focusing on two questions: how is trauma-informed care evidence in care interaction as family caregivers engage with the formal support system, and what recommendation can be made to customize and adapt TIC practices for dementia care? So to move on to the theoretical framework, we adopted the trauma-informed care framework from the Substance Abuse and Mental Health Service Administration. And there are 6 principles included in this trauma-informed care approach. We summarize their original definition onto the right side of this slide. And just to quickly introduce each one of the original principle and their definition. Safety is including ensuring patient and their staff member safety is a top priority, both physically and psychologically. Trustworthiness and transparency, focusing on the system operate in a transparent manner with the intention of enhancing and sustaining trust among and between all levels of care system. Empowering voice and choice, focus on the emphasizing strengths and experience in attempt to build resilience and promote healing. Collaboration and utility, focus on recognize that all individuals in our organization have a role to play in creating and maintaining a trauma-informed care system, and emphasizing partnership in attempt to level power differences. Cultural, historical, and gender issue, focusing on incorporating policy, protocol, and processes that are responsive to racial and cultural needs, and also recognize and address historical trauma. And last but not least, it's peer support, focusing on building trust, enhancing collaboration through shared experience to promote recovery and healings. So to move on our analytical approach we used for this paper, we adopted a hybrid inductive and deductive thematic analysis guided by the 6 principles of the TIC framework. So we use deductive analysis to identify any recurring patterns that align with the original principle, original TIC principle, and we use inductive analysis to examine any data that may not align with this principle to generate new principles that are more specific and representative to the dementia care experience. To get into the finding section, so our finding sections are presented in alignment with the TIC principle, and each principle serves as a lens for us to examine and explore caregivers' experience in accessing formal support. And we also revised and adapted the original definition to for the practitioner to better apply them in a community setting. So for the first principle, safety, it includes both physical and mental aspect of the interactions between family caregivers and a formal support system. So in this exemplar here, PO7, a 72-year-old caregiver talking about at a point of despair, she was forgetting to take her pills. She has high blood pressure and Addison disease, stress worsening both conditions. So many caregivers have pre-existing health conditions. However, issues like chronic shortage of home care workers or unwillingness to work with people living with dementia jeopardize their mental health safety, and it consequently impact their physical health. The next principle is trustworthiness and transparency. So we find there's lack of trustworthiness and transparency in the interaction at both organizational and interpersonal level when caregiver accessing formal support. In this exemplar here, showing an interaction between the caregivers and the healthcare professional during the disease diagnosis stage, where the caregiver was really having a hard time trusting the medical professionals. So she describes the whole process as you sit down, do the test in 10 minutes, you feel you have dementia. So many caregiver voice there's really lack of space and time in the current healthcare system, where the healthcare team and professional view the family holistically, especially during the disease diagnosis stage. And moving on to the next principle on peer support and self-help. So caregiver express the need for space to share experience and feelings. So the quotes here ask a question asked by PO8 in this exemplar here. Is this normal for families? Are there some common aspects? These similar questions are asked by many other caregivers in the interview. They find having a space to ask questions not only help them in sharing similar experiences and feelings in accessing services, but also serve as space for them to get practical knowledge and information in accessing formal support services. And the next principle is on collaboration and mutuality. So collaboration among caregiver, coordinator, and healthcare professionals is common, but caregiver often face resistance to power sharing from different professionals. In this exemplar here is showing when is an example when caregiver was asking whether a small amount of dressing supply can be stored at home for easier wound care management. And this option was denied. And she further offered 2 more options for either give her extra home care hours for her to make the trip to the pharmacy to get the supplies, or for the team to come every day to do the dressing. And both options were denied again. And this caregiver ended up to figure out the whole situation by herself. So many caregivers find the healthcare system, instead of actively work with the caregiver to come up with solutions, caregivers often have to modify their expectation, fight for the system, or fit their schedule into theirs in order to receive or partially receive the support they needed. And the next principle is on empowerment, voice, and choice. So it's include opportunity for caregivers to shape policy and address community level concerns, also and individual needs. So in this exemplar here, P06 talking about the system wasn't really set up to meet the BC's mandate of home first. And the government, we need to be able to design it ourselves, and the government need to give the caregiver money to hire their own help. So many caregivers have ideas and suggestions on how to shape policy to better fit their needs and preferences. However, they find their voice are often deprived when their needs and preferences were contradicted with the type of service or support offered by the healthcare system, leaving them powerless in making choices. The next principle is cultural, historical, and gender issue. So we find that there's differences in trust and acceptance of the healthcare system vary by generation, and gender also influence assessment of formal support. In this exemplar here, showing a care encounter during a home care visit, where the healthcare team say all the presence of being functional because this caregiver's father was very concerned about appearance. So signs such as a well-groomed appearance, avoidance of care, or design to maintain independence can be associated with gender positioning and should be taken into the consideration when thinking about the type of services they need. The last but not least principle is uncertainty. So this is a new principle we developed and added in addition to the original TIC principle. Given unpredictability of dementia progression and the changes in family dynamic when accessing formal support services, we find caregivers often experience a sense of uncertainty throughout their caregiving journey. So in the first exemplar here, the participant talking about having a diagnosis did absolutely nothing for us. So many caregivers were saying having a diagnosis may offer some reassuring. However, they often voice the need for a dementia ambassador or navigator at the start of the journey to support them in locating into and resources to navigate the healthcare system. And also navigating the healthcare system can be challenges. In the second exemplar here, participant 10 were talking about imagine dealing with the healthcare system at 90 years old, and you're just completely overwhelmed and you don't even know where to turn. So each caregiver have different capacity and ability, and their energy level are quite different. Also, someone who had experience interacting with the formal support services may experience less uncertainty compared with who's not. So to conclude my presentation, we find there's really a lack of literature on using a trauma-informed care lens to view caregivers' experience in accessing formal support services. And caregivers often experience trauma when they're navigating the services and trying to locate the support they need. And also we developed and added the new principle uncertainty to the original trauma-informed care framework to address the dynamic progression of dementia and changes in family dynamic. And also in our paper, we propose some recommendation for the practitioner to consider, include recognize the signs of trauma in the families. So trauma signs such as anger, anxiety, poor compliance with the care can be signs of trauma shown in the family. And also acknowledge social context of care, including recognize how cultural, historical, and gender issue impact the way they're accessing the services. engaging power sharing with caregivers, including empowering them with tools and resources to shape and design their own care, and also offering space and time to address the caregivers' mental health needs along with their immediate care needs, and also considering adding position or roles such as dementia ambassador or navigator to help support and address the uncertainty for caregiver to navigating this caregiving journey. So this is the end of my presentation. Thank you very much. I'll stop sharing and hand it back to Jennifer.
Thanks so much, Christine. So I talked too long and we have a bit of time left, but I thought I'd just ask Christine a couple of questions before I throw it out to other questions from all of you, and I hope you have some. But a couple of the things I talked about a bit more from an administrative point of view, but I'd love to know your perspective, Christine, is can you share a bit about the process of how your group came together? How often did you meet once you kind of coalesced into that group? And what kind of supports did you need or wish for from the core group?
Yeah, absolutely. Yeah, I can definitely share how our group came together. At the very earlier stage of this writing group, Jennifer and the core team were presenting on their original chair studies and different data they're having. And like Jennifer was introduced earlier, there are so many different codes. So they have created a big group chat, including everybody in this group on Slack, and sort of inviting people to share their areas of interest and what are some codes they would hoping to looking at. So for my group, I remember there was a big code called formal support in community. So I sort of shared that into the group chat, and a student who share similar interest and background sort of reach out to me, be like, hey, like I'm interested in looking at formal support and particularly how people are accessing services in a community context. So we, with the help of the core team, we sort of form our small group, small team, and we're having like more focused conversation on how we would like this paper to develop and what sort of expertise or contribution we can bring to this team. And I think when we are getting to really developing this paper, especially during the data analysis or really the midst of it, we were having a weekly meeting. So we really have like a set schedule on every Friday to have like mostly 2 to 3 hours like Zoom calls with the small groups to check in with each other on the data analysis piece and the writing part. Beside that monthly big group meeting. In terms of the support from this writing group, I think there are really different ways how supports were offered by the core team group. I think the big part of it is that monthly Zoom sections offered by the core team. So like Jennifer was mentioned, it was very systematically designed. I remember from the very first couple of workshop, it was focusing on the approaches to qualitative thematic data analysis. Then moving on to the data curation, like how to select and present data into a manuscript, and it's move on to how to the review and submission process, how to select the target journal, how to write the letter to the editor, and how to write the revision part. And also, I remember the last couple of workshops were focusing on the end of stage knowledge translation. What does it look like in terms of how we do it in social media, how to write policy debrief, how to design informatics, and our very last section was on how to present in conferences. And also another support really offered by the group was the different ways to communicate with core team members. So Jennifer mentioned we have the big group chat on Slack. So that's mostly for us to get like announcement or reminder of things. And also there's a share folder, a UBC shared folder, shared drive, where we have the monthly Zoom recording to review particular on like each of the workshop sections and other reading resources we can use. And also there's really that opportunity offered by the core team for one-on-one sections with any of the core team members. So I know like each paper sort of really have different focusing and ways to analyze data. So for our group, we rely very much on Jennifer and Dr. Kang at the earlier stage to help us shape the data analysis and what data set we should use. And at the later stage, our group and we were more having like one-on-one conversation with Lucy on how to present data in the discussion section. So you can have that customize your dream team like through the core team members. And I also like another support I really appreciated from this core team is it's the way they help you to nurturing your peer support. So it was never really about what the core team wanted or what the core team wanted you to write about. They were always there to support you as a team and as a team leader to see what resource you need to do to develop the paper and what are the areas you want to focus on and what type of support the core team can offer. So I think after the very first couple of group section, our group ran pretty independently and spontaneously, and knowing like the core team was there to support and help us if needed. Yeah, so that's just like a general overview of the question.
Thanks, Christine. The other question I wanted to ask you before we end our part is one of the things that's always very fraught in these situations, especially bringing together a lot of people that don't know each other, is authorship. And I think one of the things I set out, so I explained in my presentation, a lot of work had been done already at this point. So I kind of set out the expectation that the core team members that were still actively working on the project would all be co-authors. I would be senior author at the end because all of those people contributed to the conceptualization of all of these papers and now the writing and the editing and all those things. But can you talk a bit from your perspective about the authorship and how that worked in your group and just reflections on what it's like as a student to be in that situation?
Yeah, absolutely. Yeah, I can talk about my group experience. I think it really key like facilitator for like navigating this authorship is that very early, ongoing, and transparent conversation between different team members. And I think the support we have from the core team members, it was, I think, very early sections when we were even forming the group. Jennifer and other core team member was starting to talk about, think about what you can bring into the team and what contribution you can make to like writing this manuscript or joining this group. So it was a very early communication to start thinking about our contribution expertise in and our role in these papers. And also, I know there's different, Jennifer mentioned there was different checking points. And during these different checking points, we were always asked to get write like a quick status report, something like that, sort of to reflect what we have done, what we're doing right now, and where we are going. So that's really helped us as a group and also as an individual to sort of reflect what the progress and the contribution as a team and as individual that really help us to navigating this authorship. And also I think really this the conversation I was saying that earlier, it wasn't really a one-off conversation. The core team member often brought up this conversation about authorship throughout this workshop experience, and it served as a great conversation starter for more like junior researchers like myself to have this conversation with my team, because it can be intimidating for me to have this conversation just out of blue to talk about authorship with my team members. But we often follow because like the big group always talk about this authorship like not problem issue, but talk about this aspect. So it's very naturally flow to my small group, be like, hey, like, how's everybody feeling about authorship? Are we still happy with the way we're doing it? And so it wasn't a big surprise at the end, like, FYI, I'll be the lead author. It wasn't like that. It was always a very clear, transparent, and ongoing conversation with authorship.
Thanks, Christine. So I'll hand it back to Ash to facilitate any more conversation we'd like to have.
Thank you very much. So we're at 1 o'clock. So I'd first of all just like to thank our audience members for coming and listening and learning and asking your questions. It's appreciated. And thank you very much to Christine and Dr. Baumbusch for sharing that really exciting and interesting project. I hope you all have a good afternoon.